Failed back surgery syndrome, FBSS. They actually created a term because it fails, surgery fails, more often than not. And I'm going to go through the definitions and then I'm going to read you a study so you understand what it is and the implications of it. So failed back surgery syndrome. Failed back surgery syndrome, I'm getting this definition from International Neuromodulation Society. Failed back surgery syndrome refers to a subset of patients who have new or persistent pain after spinal surgery for back or leg pain. Now, if you look at it logically, basically what this is somebody has back pain, they're referred to a surgeon, the surgeon suggests surgery, they go and do surgery. Now, what caused the back pain to begin with, and what's the root cause of the issue? Now, we know for the most part it's going to be abnormal loading, right? Or lack of movement or lack of correct movement. Those are the main things. So going into surgery doesn't fix the root cause of the issue. So you're doing a very invasive thing. You're going under the knife, right? They're putting you under. Most people don't understand the implications of having surgery anyways. It's bigger than what they think, right? So if you go under the knife and you're cutting your skin open, you're cutting meridians, energetic meridians in the body, which can affect you in numerous ways. It's trauma to the body. And if it may not work, then you probably want to look for other solutions endlessly to fix the root cause of the issue, because surgery is not going to fix the root cause of the issue if that's not what got you there in the first place. Trauma, for example, I tore my pec muscle off the bone. That needed surgery because I needed it reattached. Without it reattached, I would be in a world of trouble. I wouldn't be able to use my arm properly for the rest of my life. That's a different scenario. With back pain or degenerative discs or a bulging disc, we know what causes it. And it's abnormal force loading, lack of correct movement, and usually all those things can be reversed very simply. It just is knowledge that the person needs to know. So if you're doing things daily that are causing you to put more pressure on the discs, and over time we have a bulging disc or a slip disc or degenerative disc, which we all have degenerative discs, we all have wrinkles, right? So degenerative discs or the lessening of the disc is just like you having wrinkles in your body, and now we can do things that are anti-aging to get more suppleness in the disc. And that comes down to essentially movement and nutrition, because you have a lot of ligaments that surround the disc to protect it. So it needs movement to get more nutrient. It needs more movement to get nutrients than other parts of the body. So this is why it's very vital to do an exercise program specifically, and that's biomechanically correct, that's doing the right movements. This way, you're getting blood flow and nutrients, therefore you're doing the correct movements, and then you're getting to the root cause of the issue. You can actually create more suppleness in the disc, right? They can be here, and then later on in the MRIs, you can see it's getting more and more supple. Now, who wouldn't want that? If you're watching this and you have a disc issue, would you want the disc to go back into place through movement and exercise, or would you want them to cut open, shave the disc, or fix that and not actually fix the root cause of the issue? So part of the reason why I share this information is because the last thing I want anybody for my clients is to go through surgery, because I can't tell you how many times I've had people come to me as the last resort and then they never go through surgery and they don't have back pain. So that's what I do this for, and that's what I'm sharing this for, because if you're suffering from back pain, you want to get the solution at the root cause, or else you'll never get the solution. And that's why failed back surgery syndrome is a syndrome. And if you've seen my other videos, I've actually, a person who did the coding for insurance for the spinal surgeons came in to do an assessment with me. I had no idea who she was. She had a back pain, and she said she would never go and do back surgery because she sees the numbers of what is going on. She sees the people coming back for surgery again or on painkillers, et cetera, and she knows the real deal of the statistics that unfortunately are not shared with you guys or not shared with all of us in the population. So she saw the actual statistics from the insurance coding. We are not getting those statistics. So I can tell you that it's probably way worse than what is even said. Anyways, back pain, this is in NCBI, which is a journal. You can find it online. It's called Failed Back Surgery Syndrome, Current Perspectives. And basically it gives an introduction. And I'm gonna read this short introduction really quick so you guys have an understanding of what's going on with back pain, because it is one of the most prevalent things and it's causing massive issues throughout the world, all right? So the introduction, back pain is a highly prevalent condition that can have a tremendous social, financial, and psychological impact on a patient's life. Low back pain is a worldwide problem with an estimated 9.4% global incidence, creating more disability than any other condition in the world. Prevalence of low back pain increases with age, so it is understandable that there is an increasing rate of surgeries to treat back pain in accordance with an aging population demographic. It is estimated that from 2000 to 2007, the total number of adults in the United States with chronic back pain increased 64%, from 7.8 million to 12.8 million, with a mean age increasing from 48.5 to 52.2 years. Now, I want to read that again so everybody understands, because this is unbelievable what's actually happening. It is estimated that from 2000 to 2007, the total number of adults in the United States with chronic back pain increased by 64%. What is happening that's increasing by 64%, from 7.8 million to 12.8 million, with a mean age increasing from 48.5 to 52.2 years. Considering the significant increase in the prevalence of back pain over time, it is understandable that there are similar trends in increasing rates of surgeries to treat it. Between 1998 and 2008, the annual numbers of hospital discharges for primary lumbar fusion increased by 170%. It actually says 170.9%, from 77,682,000 to 210,000, over 210,000. During the same period, the rate of laminectomies increased by 11.3%, from 92,390 to 107,790. However, sometimes surgery fails to provide relief, or provides only temporary relief of patient's pain. International Association for the Study of Pain defines failed back surgery syndrome as lumbar spinal pain of unknown origin, either persisting despite surgical interventions or appearing after surgical intervention for spinal pain origin in the same topographical location. All right, so this is super important because they're opting for surgeries, but the surgeries aren't working. So more people have back pain, there's more surgeries, the surgeries are failing, people still have back pain. So my recommendation is just don't do surgery if you're watching this, because there is a solution. Now, like I said, I'm not a medical doctor. There are times when you have to get surgery. Okay, so cauda eye, queen eye syndrome, gotta get surgery. It's that you'll cause further damage. That's a different story. We're talking about, you know, lower lumbar pain, nagging, aching, lower back pain, bulging discs, things of that nature. So then it goes on to say the abstract of the study is the treatment of failed back surgery syndrome can be equally challenging to surgeons, pain specialists, and primary care providers alike. The onset of FBSS occurs when surgery fails to treat the patient's lumbar spinal pain. Minimizing the likelihood of FBSS is dependent on determining a clear etiology of the patient's pain, recognizing those who are at high risk, and exhausting conservative measures before deciding to go into a revision surgery. The workup of FBSS includes a thorough history and physical examination, diagnostic imaging procedures. After determining the cause of FBSS, a multidisciplinary approach is preferred. This includes pharmacological management of pain, physical therapy, and behavior modifications may include therapeutic procedures such as injections, radiofrequency ablation, lysis of adhesions, spinal cord stimulation, and even reoperations. None of which will solve the root cause of the issue. So none of that will solve the root cause of the issue. So there you have it. Now, there are movements that you can do. You can find tons of videos on this channel that I show you movements that you can do that will help get blood flow, nutrients, and oxygen to your lower back, start to increase the suppleness of the disc, get rid of pain, improve flexibility. There's just a ton of things that you can do. The biggest thing that I advocate is taking personal responsibility for your health and your life, and taking your pain in your own hands, meaning getting rid of the pain by learning how to get out of pain. Pain is a skill that we learn. Every skill, everything we have in our life is a learned skill. We got good at getting in pain. Now get good at getting out of pain and being pain-free. And it's possible because I have done that, and that's why I'm here sharing this with you, and you can do it too, and I know you can. And I'm here to tell you that millions of people around the world are suffering from back pain, and we've helped tens of thousands of them because they chose to go a conservative route, which is, this is considered conservative, but this is just the way it will always be. The way it will always be is to fix at the root level of the pain in a biomechanically scientific way that decompresses the spine and gets more blood flow and nutrients to the area, so it takes the disc off the nerve so there's no pain, so that you are now able to move freely. Your back isn't locked up or stiff or tight all the time. Your hips are mobile. You're walking taller. You have better posture. So those are the things that I like to transfer to other people. I hope you found this helpful. If you're considering surgery, leave a comment below and let me know why you may be considering it, or just share any info you have. You can leave comments below. If you want, you can try our program, Back Pain Relief for Life, which is backpainreliefforlife.com. I'll leave a link below. That is a full program where I go through coaching. I actually take you through different levels. We have level 1, 2, and 3. We have a follow-along video as well as a coaching video where it describes why you're doing what you're doing. And then a bunch of other bonus material like morning mastery, which is what to do in the morning when you wake up, just to kind of get your body moving, which is not the normal things that most people are doing. The intuitive thing that people do is not what you want to do, which is like the twisting and popping and so those are the things that will actually create more damage. So I hope you found this helpful. Leave a comment below. Have a great day.